Hey girl, I am so happy that you clicked on this video. I'm assuming if you're like me, you're in your jammies, you're snuggled up in bed, and you're searching YouTube for videos about people's experiences with an IUI cycle. Well, you're in luck. This video is going to cover everything from cycle day 1 all the way down to cycle day 28, some tips and tricks in the middle, as well as pricing for most procedures and medications that you take at the very end. So please make sure you stick around for that. Let's get into it. Most fertility clinics will ask you to give them a call on cycle day 1, which is the first day of your menstrual flow. It should be a full red flow, not the brown spotting that you can have like leading to your period. They want to make sure that you need a tampon or a thicker pad that day. So for the sake of this example, I'm going to say January 1st is cycle day 1 for me. I call the clinic. Boop, 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 boop. Hello, just wanted to let you know that I'm on cycle day 1. On that phone call, they will schedule your cycle day 3 baseline ultrasound. So that would be Tuesday, January 3rd in this example. So I'm going to pick another color and give it a circle here. And that's the day you go in for, like I said, your baseline ultrasound. It is a transvaginal ultrasound, and it can be quite uncomfortable, more like maybe it's more of an embarrassment because you know you're still bleeding on that day and you have to undress from the waist down. You get a long wand that they stick into your vagina to look at your ovaries and your uterus, and they just make sure that everything looks okay and that things are good to proceed. Also on that day, the doctor may tell you that you will start taking your fertility medication like clomid, or I think it's Femara is the other option. No, it's letrozole. I think it's clomid or letrozole that you can take. I was always on clomid all 4 of my cycles. So you will start that on, I recommend, the night of cycle day 3 for 5 days. The reason I take it at night is because it does have some side effects. You can experience hot flashes. You can experience blurred vision. I think irritability and some other strange things that can happen. So I would prefer just to sleep through all of that and not have to deal with it during the day. When you go in for your baseline ultrasound, they will also schedule your cycle day 11 or 12 follicular ultrasound. So depending on your past cycles, if you've been tracking them, based on maybe the fertility clinic and how they do things, they will pick if it's going to be day 11 or day 12 that you come back for your follicular ultrasound. So on that day, it's the same thing. You undress from the waist down. They do a transvaginal ultrasound, but this time they are looking for your follicles, how many eggs you have that have increased in size, which ones are big enough that it looks like they could be released. And basically, depending on the size of that follicle with your egg inside, if it's large enough, then they can kind of guess if that one's going to release or not, or if you're ready. So sometimes when you take fertility medication, you can have multiple large follicles, and that's totally fine. That's actually what the medication's supposed to do. It gives you a higher chance of becoming pregnant because multiple eggs are ready to be released. The only scary thing with that is that if all of them release, like 3 or 5, if all of them are healthy and get fertilized with the sperm, then you could potentially have 3 to 5 babies in your uterus if they all implant and everything's healthy like that. So that's the only warning against using that fertility medication, is that it can cause multiple pregnancies. The doctors usually do have some options for if you would wish to terminate some of those, if you want to keep them all, like you would discuss that with your doctor if that were to happen. So anyway, let's get back to the follicular ultrasound appointment. On that day, they will let you know if you're ready to take your trigger shot or not. So in my experience, the trigger shot I always took the evening of my follicular ultrasound day. So I'm going to put a T here. And what that is usually it's called Ovidrel, and you can get it from Walgreens or CVS, whatever pharmacy you prefer. And it looks like this. It comes in a box. And it is basically a shot that is pre-filled and ready to go. So this one's already used, but I kept the box so I could show you. So your partner basically would take this shot out. It would be full, so it would be more like this when you see it. What they do is they remove this piece here. You can see that there's the shot. You pinch your skin on your belly between your fingers, and then you stick the needle into that fatty part of your stomach, and then your partner would just push this down and administer the medication. So that is what the trigger shot looks like. That is usually done between 6 p.m. and 8 p.m. the night of that cycle day 12, unless your doctor instructs you to do something differently. They also will tell you that you need to have intercourse that night. So that's something else on the agenda that you have to do. You go in for your follicular ultrasound, you have your trigger shot at night, and then you have to have intercourse. At your appointment, they will then schedule when you're going to do the actual IUI procedure. So my IUI procedures were usually done 2 days after that ultrasound and trigger shot. So for my example here, the IUI would be on this day. It really just, again, it depends on your cycle. It depends on the length of them and what your eggs look like. So it could be shifted a couple days, to the right. I don't think it would be any earlier than the 11th, but it could be day, 13, 14, or 15. So one thing to note about the IUI appointment is that it takes pretty much 4 hours to get through the whole thing. So I would recommend that you plan ahead and ask for time off if you need to from work, and your partner should probably do the same. Now, if you can't do that, your partner can certainly have his appointment, do his thing, then you can go in for the actual IUI procedure, but then you would be doing that alone. So, again, it's completely up to you and what you're comfortable with, but for me, I just preferred to have my husband there to hold my hand during the IUI procedure, because when you think about it, that's the day basically that you could be making a baby. You're getting that process going of your future baby, and I really wanted my husband to be able to experience that with me. So that's why we did things that way. Usually the andrology appointment for your partner to give his sperm sample is in the morning. Ours were usually around 8:30. Then they take the sperm, they wash it, they spin it, and then they weed out all of the bad sperm, immobile sperm, unhealthy sperm, and they only leave the healthy ones for the actual IUI. That whole process takes, I think, an hour and a half, 2 hours. So then the actual IUI procedure, at least in our case, was always set for 11. So partner's appointment at 8:30, actual IUI starts at 11. So we would go on coffee dates, we'd check out new breakfast places, we'd kind of explore the area where our fertility clinic was, and so that kind of made it nice to have time to spend with each other and talk about things, before you go in for the IUI. Now, this is a pro tip here. Make sure you're listening. I hope you're still here. When you go in for your IUI, make sure you have a full bladder. Now, not full like you're going to burst and pee your pants, because the doctor is going to be down there poking you and you don't want to accidentally pee on them because you're so full. Just a full bladder, yeah, I have to go to the bathroom, but I could probably hold it for another 30 minutes. And the reason for that is that your bladder sits here. If this was your stomach, if you're laying down, this is your bladder. Here is your uterus underneath it. I have made the mistake of going to the bathroom right before our IUI appointment. And since my bladder was flat and empty, my uterus was sitting up higher than I guess it should be, because when they go in to do the actual IUI, they want to be able to see your cervix opening, and mine was like up high because my bladder was empty. So you want a full bladder so that it pushes your uterus down, so that's right in line with where they're going to be sticking that catheter to do the IUI. The actual IUI procedure is just like a pap smear. They use the speculum to like open up your vagina. They have a long tube with like a syringe on the end, and they stick that tube in your cervix. It can be a little bit uncomfortable. You can feel some cramping or like some sharp kind of twinges when they're doing that. And then they will send the sperm into the long tube, and then that will go up into your uterus and fallopian tubes. Again, that can kind of have a cramping, like burning feeling. So that's why I always wanted to have my husband's hand just to like help me breathe through it. And that doesn't happen for everybody. That's just how it felt for me. So don't worry, yours could be totally fine. Then after that is done, you will lay on the table for about 10 minutes just to let everything settle and let the sperm do what it needs to do and swim where it needs to go. Once the timer goes off, then you can get up and go on with your day. They do recommend that you don't do any strenuous workouts afterwards, no like straining or jumping, just because you were just pumped with some fluid, and they want to make sure that it stays up where it needs to rather than leaking out. Usually with an IUI, I didn't have any like leakage, nothing came out. So that's really good. So that made me feel really confident, like, all right, we've got a good chance here because nothing came out. Then after the IUI is the worst part of the whole thing. And that is, let me get a different color here, your 2-week wait. So after your IUI, you have a full 2 weeks before you can take your pregnancy test. Doctors will tell you that they don't want you to take your test any earlier because that Ovidrel shot actually contains a little bit of the pregnancy hormone in it. So if you were to take a pregnancy test maybe a week after the IUI, it could give you a false positive. Then you would think you were pregnant, and then you find out a week later that you actually weren't. And just save your heart from that stress and that heartbreak, and just wait the full 2 weeks and take your pregnancy test 2 weeks after that IUI. So I'm going to put PT for pregnancy test. If you do get a positive pregnancy test, you have to call the clinic right away, and then they'll have you come in for some blood work, and they will, I think, have you come in every single day or every other day to confirm the pregnancy, and then to make sure that your, I think it's your HCG levels are rising with each day or 2 days that go by. But anyway, back to the IUI. This is what a full IUI cycle looks like. It's very involved. If you have to get blood work in between any of these days or on these days, it can take a little bit longer for each appointment. Doctors will usually check your estrogen, your progesterone. Sometimes they'll check your thyroid if there's suspicion of hyper or hypothyroidism. They will also check your AMH levels, which is your ovarian reserve, to kind of guesstimate how many eggs you have left. There are some other tests they can do, like estradiol, or I don't know. There's just so many different tests that different patients need depending on their medical history and background. So just know that these are the appointments that you're going in for just for like the IUI cycle, but there might be little appointments in between to do blood work. So now that we've talked about the whole IUI cycle, I hope you're still there. We're going to start talking about pricing. So clomid with insurance for us only cost about $5. We were very, very lucky with that. Without insurance, clomid is around $25 to $30. Ovidrel, on the other hand, even with insurance, I've got my notebook here. With insurance, was still $107 every cycle that we needed to use it. Without insurance, Ovidrel can be $220 to $250. So that's like a big one that it hurt to pay for out of pocket. Then the ultrasound without insurance can range from $230 to $280. The blood tests, so this is each blood test without insurance, can range from $120 to $170. The andrology appointment, which is the appointment for your partner without insurance, can range from $240 to $250. And then the actual IUI procedure without insurance can range from $300 to $350. So when you're going through fertility treatment, it's not cheap. It's a money sucker. It's a time sucker. It can cause a lot of stress. And so I just encourage you to really do your research, save money, if you can, to be able to afford these. I hope that you have insurance to help you with your IUI cycle, but I'm assuming that you're watching this video because you're going to get an IUI soon. I wish you the best of luck. I give you all of the good, happy, healthy baby vibes. I hope that the IUI works for you. I hope this video helped you kind of prepare you for what's going to happen and what you're going to experience. And if you like this video, please give it a thumbs up because it really supports my channel and it shows me that you care.